We have a program for people with diabetes and also children with obesity, where we deliver 10 weeks of groceries to the participants' home. We also provide nutrition education, as well as supplies for cooking and cleaning, and a small cooking appliance. One of our goals is to reduce the amount of hospitalizations that people with poorly controlled diabetes have. They're at risk for developing complications. It starts affecting your organs and other aspects of your health.
I'm diabetic, unfortunately. I was very strong on sweets, very strong on fat food. I went to the doctor, they did a physical, they was like, you're pre-diabetic. And I'm like, oh, okay, whatever, I'm good, I could do good. No, fortunately I wasn't listening, I should have listened. And when I got tested again, my sugar was higher. So I asked for help.
When she first started the program, her hemoglobin A1C was above 12, which is, very poorly controlled diabetes.
When I had a 12, I kept feeling like I was sweating a lot. I used to have a sugar to 400. I couldn't really walk a lot. I wasn't doing the right stuff.
And we just saw her confidence grow with the foods that she was choosing, the foods that she was feeding to her daughter.
My daughter, her name is Mercy. She's 13. She didn't like squash, and I got her to eat squash now. I said, try it a little bit. It doesn't hurt to try. They'll purchase your meal. They'll give you a grocery box.
So these boxes contain the groceries that we deliver to our clients. The boxes are delivered to our office here in Springfield, and then from here they're loaded up into our delivery vehicles and brought straight to the participant's door. In the boxes are fruits and vegetables, meats, dairy products, grains, some other convenience items. What we find is a lot of people get really overwhelmed going into the grocery store. A lot of people that we're serving live in areas where grocery stores are not entirely accessible, and so they're not able to shop for a whole week and take that home on a bus or walking or in a cab. So we're able to bring these foods straight to their door, carry them up the stairs for them. All of the individuals in our program are also food insecure. So if you're asking them to spend money on something that they possibly haven't tried before or don't know how to prepare, this takes that away, where, if we're offering Brussels sprouts and they've never had those before, and we also provide a recipe and we also provide instruction on how to cook it, it's less of a risk, and they discover that they like a new vegetable.
Don't knock nothing until you try it. That's one thing I'm gonna teach you now, because I had knocked stuff down I thought it was nasty. Then I tried it. The first day was nasty, but the next day I liked it.
When I first became a dietitian, my goal really was to feed people. A lot of times when people think that they're meeting with a dietitian, that they're gonna be meeting with someone who's gonna deprive them, and that is just not our philosophy. We wanna feed people, we wanna teach people to do this on their own and eat well and enjoy their food. We wanna make sure that they know that they're not going to have to give up their favorite foods or their foods that are culturally important to them. We can teach them how to do portion control, how to maybe tweak those recipes to make them a little bit healthier.
They taught me how to eat yogurt. I hated yogurt. I took my risk. I tried a Greek yogurt one day. I put blueberries, raspberry, everything in a blender, and I blended it up and I tried it. And ever since then, I fell in love with it.
She was an amazing participant. She really took advantage of all of the aspects of the program. She joined our Zoom meeting for our group every week, no matter where she was. She came to the meeting when she was on a bus, in a waiting room, in her home.
The classes they give you, they do Zoom, and there's 3 ladies in the program. One cooks in front of you so you can learn how to do the different meals. But once you get to know the girls, you feel comfortable to the point you could talk to them with no issue. They don't judge nobody. The program, everybody listens to you. Nobody picks on you in the program.
We're not judgmental. We're here to help. We're here to teach. And at the beginning of the program, the clients are able to choose one of 3 small cooking appliances. So a microwave, a slow cooker, or an induction cooktop. We also give a supply bag, which has some cooking and cleaning supplies. If people are cooking at home and they might not be accustomed to that, we give measuring cups, a cutting board. We teach about food safety, so how to clean your kitchen to make sure that you're not getting sick from, bacteria and germs that might be on your counter, a meat thermometer. For people with diabetes, we really want them to focus on getting more non-starchy vegetables into their diet.
Little by little, I changed different food habits, and I'm eating healthier now.
Jessica, I think, has done a great job. So she brags to us all the time how good her hemoglobin A1C is.
From a 12, when I joined the program, I brought it all the way to the 7. My sugars have stayed controlled. I feel a little much better.
She's maintaining the weight loss that she had during her program. She's passing that on to her daughter. And I just love to hear that she's been so successful in maintaining that.
I teach my daughter now how to eat healthier and stuff like that. She likes more fruits now. She likes her greens. She will eat boiled eggs than a lot of fried eggs. And she fry eggs with olive oil. I'm trying to get her to like yogurt, but she doesn't. But I kind of now know what to do. Make the stuff, don't say nothing, give it to her so she likes it.
The best part about my job is literally hearing from people that we've changed their lives. So we're introducing them to new foods. We're teaching them how to cook these new foods that they might have never seen before, and passing that on to their children is just wonderful.
It's helping my family in my house right now. So I do advise this program to everybody that can't take it.